My life as an STNA with the social ecological model. To show my life as an STNA, I'm using the social ecological model, or the SEM, which shows the factors that influence me as a healthcare worker and that I also influence as well. The first level, intrapersonal, which includes me as an individual, include things like my state test and license that requires me to uphold responsibilities and education to be an STNA, my critical listening abilities that are developed, my residents' health and well-being needs like rehabilitation, and my status as a nursing student all contribute to my work as an STNA. I can also contribute to these areas by knowing my responsibilities to make sure I am continuing to develop in each way. The next level is interpersonal. This includes my family, my fellow STNAs that I work with, the other healthcare personnel I work with like nurses and doctors, and the residents I take care of. Each of these groups in my life influence me to be a good STNA and can be seen as support to my career. I can also influence these people in my life as well by the work I complete that can have an influence on their lives. The next level is organizational. This includes things like the Stark County Health Department, the Altman Alliance Community Hospital where I work, Altman as a healthcare delivery system, and Altman College. These organizations influence me as an STNA because they each set guidelines and expectations for me as a worker. The college sets expectations for me as a nursing student as well. I can also influence these organizations with my input and ideas for improvement within each organization. The next level is the community level, which includes Alliance, the city that I work in, the Ohio Department of Aging, which does things like state surveys, Altman as a healthcare delivery system again, and the local ombudsman that works for my nursing home. These factors can overlap with organizational, and they each influence me by being the organizations and communities that monitor and set expectations for my job and set guidelines for how I should act and behave within a post-acute care setting. Although not as common, I can influence these examples as well, much in the same way I could in the organizational level. The last level is the public policy level, which includes things like the Ohio Department of Health, the Ohio State Legislature, the U.S. Center for Disease Control and Prevention, and the U.S. Department of Health and Human Services. These influence my life as an STNA by creating the laws and regulations I have to follow as a healthcare worker. They also impact the protocols I have to follow day to day. Although it is not as easily seen, I could also influence these aspects as well if I so choose to be involved heavily with the laws surrounding post-acute care.